Good morning to you, Dr. Nerurkar. So let's start with the vaccines. The CDC is now recommending the Moderna or Pfizer vaccines for kids as young as 6 months old. We know for Pfizer there's a difference in dosage for the youngest kids and those for the older children. But for parents who might be thinking of waiting until a 4-year-old turns 5 so they can get the stronger dose of Pfizer, what's your advice?
You know, Joe, in this case, timing really is everything. For children who are going to be 5 years old in June and possibly July, it may make sense to wait. For children whose birthdays are in August or September, you're getting close to the start of the school year. The best thing to do is talk to your pediatrician who has the greatest sense for your child's specific health status, risk factors, and can help counsel the parent and the family to the best of their ability.
Also, we mentioned those new Omicron subvariants. They're called BA4 and BA5. Now, it appears they target the lungs instead of just the upper respiratory tract and aren't as responsive to antibodies as other variants. How much of a concern is this?
You know, Savannah, it's not the time to worry, but it is the time to pay attention and to be prepared. We know that the BA4 and 5 subvariants are outcompeting the other variants, so it's just a matter of time before they become the dominant subvariants. In a recent study, there was we looked at the reinfection rates with these new subvariants with unvaccinated people and vaccinated people. Those who are unvaccinated who are infected with Omicron were more likely to be reinfected with BA4 and 5. So what all of this means for the next coming weeks and months remains to be seen.
And let's talk about the deaths that we've been seeing. For most of the pandemic, a spike in cases would be followed by a wave of deaths. It looks as if that is now changing. COVID deaths are near the lowest rate since the beginning of the pandemic. That's despite that spring surge in infections we've seen from these Omicron variants. So what do you make of that? What does that tell us?
You know, Joe, there's a decoupling of death and cases. So this is good news, but we still know that there's 314 on average deaths a day from COVID. That's 2 times the death rate of suicides and motor vehicle accidents. So we still can't normalize these mass casualties like this. We also have to think about long COVID. People who are under 65 who were infected with COVID, 1 in 5 will develop long COVID. For those over 65, that number is higher, 1 in 4 with long COVID. We know that this has long-term impacts on their quality of life and a burden on the healthcare system.
All important to keep in mind. Dr. Aditi Nerurkar, as always, thank you so much.
Thank you.